Today we'll be talking about burns, what to do, what not to do when you have a burn, what the different degrees of burns are, when you should definitely go see a doctor to treat a burn, and some self-help things you can do at home for first degree burns. Let's say you were cooking something and you got burned. What do you do? The number one thing that I hear is put toothpaste on it. Other people say that they would put butter on it. Some people say they would put water on it. Some people say they would put salt on it. Other people say they would wrap it really tight. So what do you do if you're on fire? Well, the first thing you need to do is to cool it. Why do you cool it? Have you ever put out a fire? After you put out the fire, do you go and touch the wood or the coal or whatever was burning even after you put it out? No, right? Because it's still hot. In the same way, your skin is still hot after it's burned, even if it's not actively on fire. The skin is still burning inside, and so we need to cool it to prevent further damage. So how do you do that? Let's just pretend my hand was burned. What do I do? How do I cool it? Some people say, oh, put ice on it. Other people say, go ahead and put it in ice water. Other people say, put it under running water. Some people say to put a cool compress on it. Other people say, put cool antibiotic ointment on it. So what should you do? The correct thing to do is put it in cool water. There's two different ways you can do that. If you live in an area where the water coming out of the tap is clean, you can put it under cool running water. If, however, that's not convenient, you can also just take a cool bucket of water and say put your hand in that if that's the burned part. If you do use the faucet method, make sure that you don't have heavy pressure coming out because that can damage and hurt the skin as well. A gentle cool mist is ideal. Now, how long do you do that for? Well, it kind of depends on how bad the burn is that occurred. So if you just touched something hot and then quickly moved your finger away, your finger still needs to be cooled, but it won't need to be cooled for as long as, say, somebody dumped hot tea or coffee onto your hand. If you just touch something for a second, go ahead and just put it under cold water for 5 minutes. If it's still burning and hot, you can always leave it for longer, but do it for at least 5 minutes. Now, if the burn is more significant or some more significant injury caused it, such as touching the hot pipe of a motorcycle or having scalding or really hot water touch your hand, go ahead and leave it underwater for 20 minutes. After you do that, the next thing to do is to remove all jewelry and potentially constricting things from your body. What happens when you get burned is that the skin around that burn will swell. And so it will be impossible to take off constricting jewelry like this. Say my wrist was burned, it would be impossible for me to take this off later. So I want to do it while I still can, if I can do that safely without taking off skin when I'm doing that. If not, I might need to actually cut it off. The reason you don't want to leave jewelry is, say your finger was burned and you had a ring right here, the ring will potentially form a tourniquet when the swelling occurs. Because you would lose circulation in your finger, you would eventually lose that finger itself. That's a very important thing to do. If you have very tight or restrictive clothing on, you would need to take off that clothing as well and put on something looser. Once you've done that, you want to examine it. There are varying degrees of burns. There are some burns that you can probably take care of at home, and there are some that definitely need to be seen by a doctor right away. So burns that can be taken care of at home are first degree burns and some second degree burns, but anything else should be taken care of by a doctor. Well, what is a first degree burn? First degree burn is a burn that just affects the top layer of the skin, and usually what you'll see is that it's red. There'll be no blisters and it will be painful. So things that cause first degree burns are things like sunburns. If you're out in the sun too long and you have fair skin, you often get sunburned where it becomes red and painful. Second degree burns generally have blisters associated with them. They're going to a deeper layer than the top layer of your skin. Second degree burns are generally red and blistered. Third degree burns definitely need to be seen by a doctor. Always. These burns aren't usually red, but instead they might be white, yellow, gray, or they might be black. They probably aren't painful. And the reason is that the nerve endings have actually been burned. So you might think that, oh, it's great, I got burned and it's not hurting. No, that's actually a really bad sign. That means you need to be seen by a doctor right away. So those burns have usually gone through the top two layers of your skin. And then there's burns that are even deeper than that, called fourth degree burns. And those have a a greater chance of you actually dying. So make sure you go to the doctor for anything
more than second-degree burns.
But let's talk about all the reasons that you should go see a doctor. So we already talked about, if there is no pain, you always go see a doctor. If it's deep, you always go see a doctor. You can see bone, if you can see tendon, if you can see muscle, please go see the doctor. Also the size of it. I would say that if it's larger than the palm of your hand, go see the doctor. They might send you home with some home care, but it's always a better idea to go see your doctor. Also, look at the location of it. If it's on your face, you need to go see a doctor. Why, you may ask? Because all of us care about our appearance and our face is important. So even if it's on your ears or on any part of your face, please go see a doctor so you can get the best cosmetic result for treatment of your burn. Now, if it's on your neck, you also need to see a doctor. And this isn't for beauty, this is actually to keep you alive. Our windpipe is located right here. You can often feel it. It has little ridges along it, and that is what causes air to go from our mouth and nose into our lungs and out again. If this closes up, then we die. So what happens when there is a burn on your neck, there's a potential that it could swell, and it could swell to the point where it cuts off your windpipe. And so always go to the doctor if there is a burn on your neck. Also, always go to the doctor if the burns are in your genitals or private area. What are other locations that always require you to go to the doctor? If the burn is in the web spaces, that's the space in between your fingers or your toes, always go see a doctor. Also, if it's on a joint, so a joint is something that bends. So here's my elbow joint, my wrist joint. We all have knee joints. So any area that bends like this, finger joints, be sure to go see a doctor. If you don't go see a doctor, there's a potential that you could heal in a way that doesn't allow you to then fully extend that joint again in the future. Also, if the burn goes all the way around any part of your body, you need to go see a doctor. As we talked about in the talk on bleeding, tourniquets cut off circulation. If there is a burn that goes all the way around, say a finger, when the swelling occurs, it can create a tourniquet, and that can cause you to lose the distal part or whatever comes after that burn. Other reasons to go see the doctor are if there are multiple blisters. If there's one and it's small, you can probably take care of it, but if there are multiple blisters, just go see the doctor to make sure that you are doing everything you can to take care of the burn that you have. If there are signs of infection, you always want to go see a doctor. What are signs of infection? We talked about them in our first aid for wound care, but I'll just quickly review those again for you. If you have a fever, if there is increasing pain, if there is spreading redness, including streaks, if there is pus, if there is increased warmth, those are all signs of an infection, and if you have those, you want to go see a doctor. These will often develop maybe a day or two after the burn, but be sure to go see the doctor then. Lastly, if you are at all concerned, when in doubt, always go see the doctor. Now, let's say that you decided to treat it at home. It seemed like a first-degree burn or maybe just a tiny little blister. How do you do that? So again, the first thing is you want to cool the skin. Very, very important. You want to do it for at least 5 to maybe 20 minutes. If it's a first-degree burn and it's just red, there's no blisters, you can apply aloe vera to it. So people say you could also do pure honey. You would just apply that to the skin. If it's a second-degree burn and you're staying at home to treat it because it's just one small tiny blister, go ahead and apply an antibiotic ointment to it. Third, you want to apply a sterile gauze to it. Sterile gauze that comes in packets, it's unopened and it's been packaged, it's often labeled as sterile. If you live somewhere and you're unable to go see a doctor and you don't have anything that's sterile in a bind, you can use something that's clean. And say that's the case, let's just pretend that this is a clean piece of cloth. You want to wrap it after putting on the antibiotic ointment. It's really important to put on the antibiotic ointment if you have a blister, because if you put on the gauze or the cloth and later on you take it off, generally you will tend to tear off that blister, and you want to try to keep that intact as long as you can. The antibiotic ointment will prevent your skin from getting stuck to the piece of cloth or gauze. When you do put on the gauze or the clean piece of cloth, make sure you do it pretty loose. See, this is pretty loose and there's room for expansion of the skin because, as I mentioned, there will be swelling. If you did it nice and tight, like we showed you in the wound care video, when the swelling occurs, you will potentially cut off the circulation to the distal part of your body or the part that's after where you applied the gauze or the clean cloth. If you do happen to do that, just unwrap the gauze or the cloth and wrap it in a looser manner. In terms of pain medication, if you have no medical conditions, you can use Tylenol or paracetamol or ibuprofen or Brufen or medication similar to that. If you do have any medical conditions, be sure to check with your doctor as to what is safe for you to take. Also be sure to take only what's recommended on the packages and nothing more than that. Many times people ask me, how long is it going to take to heal? Well, if it's a first degree burn, meaning it was just red and there was no blisters, it can take 3 to 5 days, maybe up to a week to heal. There's generally no scarring associated with this. If, however, it's a second degree burn, there is a chance that it could scar. It can take up to 10 days for that to heal. If you find it's 14 days later and it's still not healed, then it's time to go to the doctor. So what are things never to do on a burn? Never put toothpaste on it. Toothpaste can actually make the burn worse and in some cases cause an infection. Never put butter or oil on it. That can lock in the heat and worsen the burn. Never put ice on it. That will further damage the injured skin. Never wrap it tightly. Why? Because you will cut off your circulation. And never put salt on it. Why? Because although salt does dry up the area, it also destroys a lot of the skin cells in that area. Now let's talk about how to prevent burns altogether so that they don't happen. If you are cooking, do not hold a small child in your lap, even if they're usually pretty quiet and don't move a lot. It only takes once and they will get burned. Also, try to keep all matches, firecrackers, candles, anything that can get burned or can start a fire away from children. And they should be set up high or in a locked drawer. If you are cooking, put the handle sideways or away from you, but never towards where you could hit it and splash the contents onto yourself. Or if somebody walking by accidentally does the same thing. So always put your handles to the side or in towards the wall, but never out towards where people walking by or you yourself could hit the handle and injure yourself. In summary, let's just go over what do you do if you get burned. First thing you do is you cool it. You cool it for 5 to 20 minutes. How do you cool it? You put it under cool running water from the tap or in a cold bucket of water. You do not put ice in that water. Also, you do not use toothpaste or butter or salt on a burn. If you decide that it's a first degree burn, meaning it's only red, or a small secondary degree burn with a small blister on it, you can treat it. The ways that you treat it are you would cool it, then you would apply. If it's a first degree burn, aloe vera or pure honey on it. If it's a second degree burn, antibiotic ointment on it. And then you loosely wrap it. Make sure that it's loose. If your fingers go numb or turn purple, you know that you tied it too tightly. What are reasons to always go to the doctor? If you cannot feel pain, if it's located in certain areas, on your face, including your ears, on your neck, on your genitals or private area, on any of your joints, the things that move. If it's in your web spaces, the spaces between your fingers and toes, and if it goes all the way around any part of your body. If it's the size of your palm, if it looks deep, if there's more than one blister, if you develop a fever or have any signs of infection, and if you are at all concerned. I hope that helps. Remember, these videos are made for people living in third world countries who don't have access to a lot of healthcare. This does not replace the advice of your medical doctor. Be sure to watch the rest of our first aid videos.